Disclaimer: the contents of Studio 151 podcast and the TU Communication Disorders Connection podcast do not represent the views and beliefs of the University of Tulsa and the Mary Kay Chapman Center.
Hello, welcome back to another episode of the TU Communication Disorders Connection podcast. This is Alyssa Hall. Today we have two special guests joining us as we dive into the Big Nine area of swallowing. Our first guest is Megan Ihrig, a second-year graduate student at the University of Tulsa.
Hi, thanks for having me.
Our second guest is Cara Milam, a speech-language pathologist and team lead at Speech and Beyond in Jenks, Oklahoma.
I'm excited to be here.
We are so excited to have you both here today and to learn from Cara's expertise. As you may hear in the background of this episode, we have another guest who is roaming around the room, one of our little friends, so do not be alarmed if you hear any extra noise during the podcast. I will hand it over to Megan to get us started.
To start us off, Cara, I would like to hear more about your background and experience. Can you talk a little bit about how you got into the field of pediatric feeding disorders?
Yeah, absolutely. So I was lucky enough to have some supervisors in both my on-campus rotation and my externships that were experienced in feeding. So I got to see a little bit of that right off the bat, and not everybody is lucky enough to have those opportunities. So, at OSU, I had a supervisor who was trained in SOS, which is the sequential oral sensory method of feeding therapy, more that sensory side. And so I kind of got a little bit of training under her. And then when I did my clinical rotation, I got more of the medical side. I was working in an outpatient pediatric, but it was in connection with a hospital. So we did get a lot of more medically complex kiddos, working a lot more on dysphagia and kind of that side of things. And then I worked a little bit with kids in my first job when I worked in Texas. And then when I moved to Tulsa in 2021, they didn't really have a lot of feeding clients for me. We had a girl at Speech and Beyond who was very specialized in feeding, and she kind of was the main person on that. So I kind of took a break from feeding for about a year and a half and really, really always wanted to get back into it, but felt like I'd been kind of out of it too long. And so when I had my son, I was on maternity leave and I finally had the chance to do some extra continuing education. He also had some feeding challenges right after birth just because of his tongue tie and some trouble latching at the breast. And so I wanted to get more into that. I'd never done the baby side of it before, so I really got into the bottle feeding, breastfeeding side of feeding therapy as well, and kind of having experience with a lactation consultant and having my own challenges with that helped me grow my passion in that area.
That's awesome. Yeah, I can tell you're super passionate about it. In your experience, can you tell us some key signs that a child might be experiencing a feeding disorder?
Yeah, so it totally depends on the type of feeding disorder we're looking at. But in babies, some signs that we're experiencing feeding difficulties might be that we're fatiguing too quickly, we're falling asleep on the bottle or the breast, we're pulling back constantly, we're coughing or spluttering all the time. Maybe we're spitting up our whole bottle, so excessive spit up. Lots of discomfort while eating, arching their back or refusing, turning away from the bottle or breast at that age. And then when we kind of get into more of solids, there's even still kind of different areas, but there's kiddos who are refusing foods, who are problem feeders, which is different than picky eater. So they are showing they're not interested in any of, a certain food group. So maybe we're only eating crunchy foods, or we're only eating purees, or we're not accepting any proteins or any fruits and vegetables. Those are going to be signs of more of that kind of feeding disorder problem feeder. And then we've also got babies who kind of are starting solids. Maybe they're gagging too much. Maybe they're vomiting when they're trying solids. Their parents are starting to see them not want to accept them. We might be pocketing foods in our cheeks or swallowing foods whole. Those are kind of all signs that something deeper is going on.
That's all very good to know. And you kind of already touched on it, but sometimes children with feeding disorders are labeled picky eaters, and we know that's not 100% accurate. So can you explain the difference for parents out there that are kind of are they picky or is it a disorder?
Yeah, absolutely. So we do see this a lot, and parents will be like, oh, they're just picky. Oh, just only offer what you're going to offer. Don't offer anything else. They won't starve. And that's just not true. Our kids will, in fact, starve themselves. If they don't want the food that you're presenting, then they might very well just not eat. And so our problem feeders are going to be, like I said, those kids who are disregarding whole food groups.
One of the first steps in treatment for feeding disorders is the assessment process. In your experience, Cara, what does the assessment process look like for pediatric feeding disorders?
So assessment for pediatric feeding disorders is a lot more informal than what our speech and language looks like. There are not any standardized assessments for pediatric feeding disorders. We do have some norm-referenced like parent questionnaire style that I like to use, but a lot of it is based on your clinical judgment. And really just like getting in there, watching the kid eat. I typically have parents bring 1 to 2 preferred foods and 2 to 3 non-preferred foods just to kind of see what they do with it, but we also want to still have some of those safe foods there for them. And then with our younger kiddos who are doing solids, I still recommend that even for them because a lot of times the non-preferred foods are not necessarily that they don't like them. It's maybe more that we can't manage them, we can't handle them, we spit them out. So they're willing to try them. They just aren't good at preparing the bolus. They're not good at propelling it to the back of their mouth. So we end up getting a lot of anterior loss of those solids. They spit them out, whether it's intentional or non-intentional. But then I also get to see how they do on foods that they do like and that they do well with. So we kind of get to see the positive and negative side of feeding. So like with the questionnaires, there's 3 that I like to use, and there are others out there. These are just the ones that I have experience with. But I like the Infant Eat for babies who are 7 months and younger. It's going to go over breastfeeding and bottle feeding. It's going to make sure that, we're going over those signs and symptoms of any aspiration. So if we have aspiration concerns, then we can get them referred for a swallow study. And then it'll kind of go into sensory regulation with the bottle and the breast, kind of how they're behaving around the bottle or the breast. And then for my kiddos who have started solids, we're kind of more on the dysphagia side. I like to use the CHOMPS. That goes from 6 months to 7 years. And then there's a third one, which is the PD Eat, and that's used by SLPs and OTs because it does talk about the physiologic instability and kind of if we're having any of those aspiration signs, but it also goes more into the problematic mealtime behaviors and the sensory regulation around foods. And so those are typically the 3 that I like to use.
So with that being said, Cara, can you share an example of a successful case or intervention that stands out to you, and you can be as broad as you want?
I did see a kiddo yesterday, actually, that this was their first appointment since the evaluation. I gave them 2 things to work on at the evaluation that I wanted to see if that would make a difference. So basically, when they came in, she was coughing on her bottle a lot. Particularly when laying down, but they said that sometimes, it was not just while laying down. And she had a swallow study back in May that she did not pass on thins, but she did pass on slightly thick. So that is just 1 step above thin, not super thick at all, and she passed on that. So they were doing that. She had a follow-up swallow study in September, and she passed on thins. But mom was really nervous to move her back down. She said she felt like when she was on the slightly thickened liquids, they were using Enfamil formula. It's called Enfamil AR, which basically has rice already mixed into it. So she actually didn't have to add any additional thickener just because she was already using this rice thickened formula. But she said when she tried any other formula, the coughing came back. And she also had some solid food stuff. She was swallowing her foods whole and not chewing fully. And so we talked about, 1, not having her lay down while she's eating. That's going to make a big difference. If you think about how we swallow, even just when you're sick and you're laying in bed and someone comes and brings you medicine and you're drinking your water to take your medicine, it is not easy to swallow when you're laying down fully. You kind of have to sit up a little bit, at least be somewhat reclined versus laying all the way down. So that was a big one I wanted her to change, is to try to stay away from her laying down while drinking her bottle. She was 10 months old, so very capable of sitting up and doing that on her own, or at least them holding her in a more upright position while she had the bottle. And then the other thing was I wanted her to try to switch formulas, because from what they had told me, it sounded like we might be having some dairy intolerance. Her sibling has dairy intolerance already that they know of. So when one sibling has it, sometimes it might be more likely for another to have that same kind of reaction. So I suspected that she was having some reflux that was adding to the coughing. And I just kind of wanted to see if those 2 changes would make a difference. Typically, we want to see them kind of change that formula for at least 2 weeks before we really expect to see any changes. Sometimes you see changes sooner, but they came back yesterday, so 1 week removed from the evaluation, and they had left that day and they had gotten Nutramigen, which is a hypoallergenic formula, and they were having no issues anymore. And it's not always that quick. It's not always that easy, but it just kind of goes to show you like how sometimes little changes like that can make such a big difference. She was on fully thin liquids, no coughing ever. They even said that she did still lay down sometimes and was not coughing on that. And then, watching her eat, she wasn't pocketing. She was chewing fully. She was swallowing her food. And that's not to say that, like, you're always going to have that correlation of the reflux and the swallowing hole. That could have just been maybe parents were modeling better. I did show them some modeling strategies of how to model chewing and stuff for her too. But she hadn't been pocketing in her cheeks anymore. She wasn't swallowing the foods whole. She was doing really great. So, we're going to continue monitoring her and making sure it's not a fluke. But we've seen a lot of big changes with just small things being done.
Yeah, that's amazing to hear. Thank you for sharing that.
Yeah.
So I know you mentioned occupational therapy a little bit beforehand. How important is interdisciplinary collaboration in treating the feeding disorders, and what are some of the other professionals that you are in close contact with?
Yeah, it's super, super important in feeding. So, I work in a clinic that has ST, OT, and PT. So it's easy to collaborate with others there because we're all in the same building. For example, PT can be really important in babies if we're having torticollis, if we're having any kind of body tension like that, that's going to hugely affect feeding. So making sure that if we are having a head turning preference, maybe we only turn our head to one side and we don't turn it to the other side, and we're seeing feeding difficulties and tension like that, getting them a PT referral can be really important. When it comes to solid foods, we want baby to have a stable core. Our body does have like a hierarchy of needs and what's more important, and core stability does come before being able to eat solid foods. So that can be a big factor in not having the oral motor skills. So that's another kind of PTOT area. But I also do refer out to other professionals. So if we've got tongue, lip, or cheek ties, I might refer out to an ENT or a dentist to get those assessed. And then there's also GI referrals, so making sure we're going and seeing a gastroenterologist if we're having significant GI issues, reflux that doesn't seem to be resolving with any strategies that we've tried, or discomfort while eating if we're kind of noticing that and we can't figure out what's going on. If we're excessively constipated all the time, we might do a GI referral, make sure we don't have slow motility in our gut, make sure we don't have any other underlying problems there. So there's a lot of professionals that kind of go into working with feeding.
For sure. It sounds like a very involved process with a lot of different team members. So what are some of the biggest challenges that you have faced when working with children with feeding disorders?
I would say some of my biggest challenges have been with more of my problem feeding kids. I typically see more on the dysphagia side in my practice because we do have OTs in our clinic who are very much more trained on that sensory side. So if I have a kid who doesn't have any underlying oral motor deficits and it's kind of all sensory and behavioral, I may be more likely to refer over to OT. It's a little bit more in their wheelhouse. I think they can be oftentimes more creative than I can be with the play side of food. And I know my weaknesses in that area. So if I feel like I'm not able to adequately help a child and they don't have any of those other kind of oral motor deficits that we need to work on, then I am going to refer them over to OT where they're going to be better at that kind of thing. But one of my biggest challenges is that some of my kiddos who do have oral motor deficits but are also working on that sensory and behavior processing side, some of them are not interested in me, in parent, interacting with foods, interacting with them. So I have a little girl who, she doesn't bite anything. She will suck all the flavors off of things. She'll eat any puree that's smooth, but if it's too gritty, too grainy, too thick, we won't touch it. We like goldfish crackers and things like that. We suck on them. We suck all the salt, all the flavor off, and then discard them. So we try to get her interacting like through play. We like Baby Shark, so we'll sing Baby Shark and we'll pretend to take shark bites and kind of get her motivated through that. But a lot of times her focus is on what she wants to be doing. So she may be singing Baby Shark with us, but she's not paying any attention to what we're doing. She knows what she wants and what she doesn't want. And sometimes you can tell it's super intentional because we'll be suggesting things or trying to model play and she'll sing louder. She'll just be like, I'm drowning you out. I can't hear what you're saying. So that has been a big challenge for me, is kind of how do I get a kiddo who is not interested in progressing their skills to be engaged and to want to try things. So that's been a big challenge.
Yeah, so in kind of going along with that, clearly our understanding of pediatric feeding and swallowing disorders continues to expand with all the new research coming out. So how do you stay updated with best practices in the field and research updates?
Yeah, CEUs are the best way for me to stay updated on that kind of stuff. I have tried to do some outside research of just like looking up articles if there's something very specific that I want some more knowledge on to see if there's more research. But I have to admit I don't have a lot of time to do that. I do have a toddler at home and my caseload is very full. But CEUs are required education. We have to have them.
And for our listeners who are not familiar with CEUs, can you explain what those are?
Yeah, just continuing education. So there's lots of courses out there that go more into depth on pediatric feeding disorder, which is awesome because I feel like it was an area of continuing education that was lacking for a long time, and we really don't get a lot of that education in our graduate programs. I don't want to speak for all graduate programs because there might be some out there who have a whole class on pediatric dysphagia, but when I was in grad school, that wasn't a thing. We had a class on dysphagia. It targeted mostly adults. We had one chapter on kids and pediatrics, and then I did have a cleft palate class that talked a bit more about young babies. So that was helpful. I will say it was hard for me personally to kind of apply that baby knowledge until I had one of my own, but I don't think everybody is that way. I think for some people it does click whether or not they've had a baby. For me, it took me seeing my son feed and, seeing how all of it worked in person in my arms to be like, oh, I understand what's going on. I can do this. I want to learn more about this. But just because my program did not go into enough detail on pediatric feeding, it was really important for me to find courses that did dive deeper into that. I took the Can Eat course, and that was very helpful to kind of learn about those medical underlying causes, to give strategies to help kids who even just have a fear around the spoon going in their mouth. That was a helpful course for me. And then I'm currently taking a course through the lactation OT, talking more in depth about breast and bottle feeding. I feel pretty comfortable in that area now, but it's always good to, kind of keep up to date. So I do rely a lot on my CEUs to provide the most recent research and best practices because I am kind of, hoping that these courses are keeping up to date, especially the ones that are just released. So
yeah, that's awesome that you're always looking for ways to improve your treatment and understanding of the disorders. And then I have one last question for you. For parents out there or anybody who might be interested, are there any resources you might recommend, like social media or apps, books?
For social media, Melanie Potok is a great follow. I don't know if I'm saying her last name correctly, but I believe her handle is My Munch Bug. She has really good tips and strategies for all types of feeding disorders, regular picky eating, problem feeding, starting solids, learning how to drink from a straw, learning how to drink from an open cup. She has lots of really good tips and videos. I really like to recommend solid starts for parents who are just starting solids with their babies, who are nervous about how to prepare foods and they don't know how to prepare foods in an age-appropriate way. And solid starts is great even for kiddos who are a little bit delayed. They may not be looking at the exact age recommendation for that child. If you know your child is delayed, then and you're not sure that they can handle let's say they're 9 months old and they can't handle the bite-sized pieces because they don't have a pincer grasp to pick them up and put them in their mouth independently, then maybe we take a step back and we go to the 6-month recommendations. I think that can be very helpful. They have visuals. They have videos of babies eating. They have tips on what to do if you feel like your baby is not handling the food well. So, we don't want to stick our fingers in baby's mouth because that can actually push it farther back in and cause more of a problem. We want to more model spitting it out, really model sticking that tongue out, getting rid of the food, doing all of that first before we jump to just reaching in their mouth and digging it out. So they have lots of good strategies for that. I actually had a parent recommend this book to me. I believe it's called My Baby Can Eat Too, and it talks about modified eating and baby-led weaning for kiddos with Down syndrome. She said she found that book very helpful. I haven't had the chance to read it yet, but from what she was telling me about it, it does seem like it is very, very helpful for that population. There's not a whole ton of resources out there for our kiddos with Down syndrome. If your kiddo is on thickened liquids and you're having trouble affording thickened liquids because it can add up, it can get expensive, a lot of people don't know about this, but there is the Dysphagia Outreach Project, and they can help with assistance. So you do have to apply and make sure you qualify for assistance for a thickener, but if you qualify, they will provide you with the thickener that you need to keep your baby safe or your child safe. So
Very interesting.
Yeah.
Thank you for sharing those awesome resources.
Yeah.
Yeah, so thank you, Cara and Megan, for joining us for this conversation today.
Thanks so much for having me.
Yep.
I hope that those of you listening along also learned something, because I certainly did. We hope we will see you next time listening in for our next podcast, and have a good day. We will see you later.
For further information or podcast ideas that you'd like to share with us, please reach out at 918-631-2504. You can ask for Chloe or Sarah. We would be happy to chat with you.
Thank you, Studio 151, for letting us record. We look forward to recording future podcasts.
Remember, communication is not just about words. It's about understanding, empathy, and connection. Until next time, keep listening, keep learning, and keep communicating.